watching Beyond Markets, where we bring you up to speed on development outcomes in Africa. Welcome, I'm Kenneth Igbomor, and on today's show, we'll explore Nigeria's journey to eradicate polio, a disease that has seen a 99% reduction globally since 1988, when there were 125 endemic countries. But according to experts, as long as a single child remains infected, children in all countries are still at risk of contracting polio. You can join the conversation on social media and let me know what you think about the topics that we discuss. And to do so, use the hashtag Beyond Markets, and also send me a message on Twitter on my handle @Kenneth Igbomor. Now, Nigeria accounted for more than half of all polio cases worldwide only as recently as 8 years ago, according to data from the World Health Organization. Since then, Africa's most populous country has made remarkable progress in the fight against polio and is on the verge of being declared polio-free. So what has been the driving force of this progress? Zouera Youssoufou, the Managing Director and CEO of the Dangote Foundation, joins me for this discussion. Thank you so much for joining me on the show today, Zouera.
Thank you for having me, Kenneth.
Yeah, listening to my intro there, we're talking about we've seen some remarkable progress in there. So what has been this driving force?
So the real impetus behind this result is the effort that all the partners have put in together, driven by the Melinda Gates Foundation. Bill Gates had it as one of his priorities in life, that he just didn't see why polio would still exist. And so they started working on eradicating polio here in Nigeria, meaning increasing polio campaigns and making sure that all children in Nigeria were immunized against polio. And they met some resistance because, of course, the idea of somebody from the outside coming in to try to help you can sometimes be misconstrued. And so he partnered with Aliko to really drive the message home. And as a son of the soil, as somebody who's from Kano, which is where the number of polio cases in Nigeria were really concentrated around Kano. So it was important to have a Kano voice speak to that. And Alhaji was a perfect person to represent this effort. And so that partnership led to several things. First of all, people recognizing that if Alhaji Aliko can put the polio vaccine in his own grandchild's mouth, it means that this vaccine is safe and it's good. If we include our traditional leaders and royal fathers in the fight, their job is to take care of the people who are under their supervision, management, under their emirates and their kingdoms, get them involved in making sure that all children are immunized. That's one of the things that we were able to bring to the table, in addition to funds. So it started off as really focusing on polio only, eradicating polio, and expanded into, well, it's not just polio that's not the only vaccine the children need. They need to be vaccinated against all childhood illnesses. And so we entered into partnerships with 6 states in the north, the ones that had the more difficult indicators. And those 6 states were Kano, Borno, Yobe, Kaduna, Sokoto, and Bauchi.
All right, it's good to put that ground footing there, and I will get into the details on your strategy later, but I would like to speak to the importance of having all the stakeholders involved and playing their part.
Yes. So without that, what we find is that, people are whole human beings, right? People have religions, they have religious leaders, they go to school, they go to work, they live in a community. And so it can't just be one part of that community making this effort to fight polio, right? We're specifically talking about polio, but it would be the same for any disease that we're trying to eradicate, is that getting the message out that children need to be vaccinated and making sure that it happens. And it starts with everything. Do we know when children are born? Are they born in a primary health care facility? Are we keeping track of the children that are being born? Are we keeping track of the pregnant mothers so that they know when they're getting antenatal care, that when they have their baby, these are the 5 vaccines the children have to have by this date, that date, and getting the whole community involved. That's what makes the difference. So yes, funds are necessary. Gavi is a good partner. They supply the vaccines for free. The primary health care system is necessary because that's where people go to get the vaccines, et cetera. But it's a community effort. So all the partners, whether it's the World Bank, WHO, DFID, Aliko Dangote Foundation, BMGF, everybody is putting in their funds and their technical assistance, and then the community has to also now join into the effort. And it's really important for us to never lose track of that. I mean, we saw a few months ago a measles outbreak in the US, and everybody's thinking, well, measles has been gone forever. But if children aren't immunized constantly, if everybody's not immunized, and we don't develop this herd immunity, then the likelihood of diseases coming back will stay with us. So even though polio is about to be done, right? We've had 3 years, no wild polio virus. Nigeria is about to be certified polio-free, which means Africa is polio-free, wild polio-free. It's important to note that, well, this is not the time to relax, because the minute we relax and stop immunizing kids, then this is when things, start going in the wrong direction.
All right, let's talk about the strategy that you put in place there. I understand there was the routine immunization, and then you had to sign like a tripartite agreement.
Yes. So the after we agreed, Alhaji and Bill agreed, this is what we should do. We signed agreements with those 6 states. And some of the agreements, we have extra partners like UNICEF, like USAID. But in all of them, the two partners are the funders. And we fund the state's basket. So imagine Kano State will have a budget for immunization. That budget, say, is 100. They pay 30%, we pay 35%, BMGF pays 35%. So the two foundations pay the same amount of money into this basket. Our money drops when the state drops their money. Technical assistance is provided to the delivery of the services, and then we now have these children being immunized in a more effective manner. So we've been having these MOUs with these 6 states for the past few years, and the really good results have been that because our contributions are on a sliding scale, right? So at first we start off, we're giving them 70%, they're paying 30%, and over 3, 4, 5 years, we get to the point where we're just supporting them technically, but they're paying 100% of their vaccine budget. This is what we did, for instance, in Kano, which was the first state, obviously, in which we started, where Kano now is 100% paying for everything related to routine immunization. And so now we've expanded the partnership to look at other things. Well, what else can we do? If the system works and we know how to immunize kids, what else can we flow through the system? Is it nutrition? Yes. Is it better maternal and child health? Yes. So now the MOU that we have with Kano includes those aspects in addition to the vaccine piece, which Kano is handling 100% right now.
It's interesting to understand that learning curve because, I can imagine you would have faced different challenges in each state, and knowing what you learned from one state helped to make the others work better. I'd like to understand that experience.
So some of the challenges are, for instance, in Nigeria, the primary healthcare system, we live in a federation, so you have the state level, you have the federal level, state level, local government level. The primary healthcare system wasn't under one roof, meaning that there's one budget holder that manages the staff, so the workers that are out in the field, that manages the budget for the drugs, et cetera, for the medicine, et cetera. And so a lot of the challenges were related to how do we get the right staff in the right primary healthcare centers to do the specific things we need them to be doing. Because if somebody is holding the budget and they're not controlling the staff, then it makes it, challenging. Some of the difficulties were things like terrain or like safety and security. For instance, you can imagine in states that were struggling with insurgency, it was harder to reach some of these harder to reach areas. A lot of the people who aren't immunized are in more rural areas, more far-flung areas where you have less access to medicine and doctors and nurses and community health workers. So just really learning how do we get to that last mile. And this is where the traditional leader system was really helpful because the voice of the traditional leader carries a weight that nobody else's voice really carries in those particular communities. And they've been instrumental in making sure that pregnancies are declared, births are declared, children are line listed, we know who's being born. The leader is held responsible for managing the children that are born in their community, etc. So these are all things that we had to learn. Because imagine in the traditional way of doing things, the traditional rulers didn't have like a mandate to manage health, but we needed them, and we still do, in order to get the results and get the kids immunized in the places where they need to be immunized, and the mothers to go to the primary healthcare center, for the facilities to be operational, for people who were assigned to this particular healthcare facility even if it's not convenient, even if it's not where they want to go, what's the system to track that they're really going? How do we make sure that when we get the reports back saying we've immunized X number of kids, that it's really accurate? How do we make sure that incentives aren't built in for people to say, yeah, we immunized 1,000 kids, but really they only immunized 100? So these are all the things that we had to learn. And if I look back at how implementing the system was 5 years ago, 6 years ago, until today, I'm feeling really confident that we've made significant progress. And when we start looking at these indicators of children being immunized in Nigeria, we will definitely see improvement.
Yeah, because talking about the progress, you have to also put it in the picture, because looking at the time that this is happening, this level of progress is happening, it's a time where the country is seeing some of the worst stories on insurgencies. You know, I can imagine how the challenge is getting your supply chains in there. But I'd like you to speak to that success story and the determination and the attitude of the people on ground, you know, and how they were able to get the message across and get these outcomes.
So for instance, a very simple example is in 2016, when there had been almost 18 months of not a single case of wild polio in Nigeria, one of the hard-to-reach areas in Borno was liberated, and all these people came in. But these are people who had not had contact with the formal health system in years, and so polio came back because somebody hadn't been immunized, and so they caught it, and oh my goodness, here we were, there was an outbreak in 2016. So that was that moment where it was clear that unless we are able to go above and beyond managing how we deliver these services across the country, there's always a chance that something could pop up. Now, most of that threat is reduced to the point where we don't think that there's any territory that hasn't been reached so far. We have all kinds of GPS satellites, maps that can see, you know, where settlements are around the Lake Chad area, around Niger Republic. So that's why we're also working with those countries to make sure that, because there's a lot of movement between borders, that in those countries that their system is also working so that they're not recontaminating us back. So a lot of the work has been really getting the message across that this is something that we have to do. These are lives that are saved. These children are now no longer paralyzed. We don't have paralyzed kids anymore. We are not having these outbreaks of disease that comes when children aren't immunized. So a lot of the success has been just the determination of our government, first of all, here in Nigeria, has really done a good job. They've been very helpful, for instance, in Borno State in particular, where, you know, particularly hard hit by the insurgency, they were very helpful. Like I said, the community, the traditional leaders, and all the partners just working together and realizing, look, if we don't solve this, it's not going to go away. Diseases don't just disappear. They have to be eliminated systematically.
Just joining us, Zouera Youssoufou, the Managing Director and CEO of the Dangote Foundation, is our guest today on Beyond Markets. And we've been discussing Nigeria's journey to eradicate polio. But then, Zouera, there's a new threat in the world right now. It's the coronavirus. We've seen how this is affecting economies globally. And, you know, I would like to know, but how much do you think this could have impacted the progress that has been made so far in the work you've been doing on this polio?
So COVID-19 is obviously a threat. It's a threat to all of us. I mean, it's a planetary problem. I think Nigeria is really doing what we need to do to manage this disease in our country. We've been very active, actively working with the Nigerian Center for Disease Control, Federal Ministry of Health, with the Lagos Ministry of Health. We've already made a pledge of 200 million naira to help improve our point of entry defenses, and that really means making sure that as people are coming in, they're screened properly. We've already done this back in the day when the Ebola crisis was here. So right now, if you look at the 6 thermal cameras at the airport in Murtala Mohammed that screen people as they come in with their temperature, these are cameras that Aliko Dangote Foundation donated. In addition to that, we'll be donating ambulances to make sure that if anything happens, if somebody is screened, that they can be quickly moved to the isolation area. We'll be providing personal protection equipment, the gloves. So there's a whole plan of what the ADF is going to be providing to support this fight. In addition to that, we also are going to be funding the application, SORMAS it's called, that does the surveillance across the country so that we make sure that if any case bubbles up that we see it. And in addition to that, we'll also pay for training of healthcare workers to make sure that they know how to deal with the disease if, and God forbid, they ever bump into it. But you were asking me about the potential risk of that. It's just one more thing that we have to deal with. It's not like a normal systematic thing that people can prevent themselves against, like measles or polio or tuberculosis. But everything right now that we know about how this disease is transmitted is very well articulated and managed and disseminated by the Nigerian authorities. And we all know to practice social distancing, wash our hands, use sanitizer, check ourselves for fever. Please self-isolate if you're feeling the symptoms. And really what's important for us is that, to the grace of, God has been grateful to us here in Nigeria. And I keep praying that the same God who prevented and kept us from Ebola will prevent us from this also, because the potential is, of course, is there. Now, if we manage the entry of the people coming from those countries and make sure that we have the right protocols and that we follow the protocols, because it's one thing to have the protocols, it's another to follow them, that we're really rigorous about testing, isolating, quarantining, making sure that the people who come from those countries are not interacting with people who don't have it here and potentially spread it, I really think that we could be okay. And I pray that we're going to be okay, because the impact could be severe. We see shutdowns in Europe, and we don't ever want to have to get to that. And we also don't want the health system to be overwhelmed. Right? The rationale for telling people to stay home is if everybody goes out and keeps contaminating one another, when we know there's a long incubation period where people don't have symptoms, if we keep letting that happen, then everybody's going to get sick at the same time and, rush the hospital, and then the hospitals won't have the capacity to respond. So if that's the case in Italy and in France and in the US, I think we would have a bigger challenge here. So really, we need to be very vigilant and very serious about staying away from this disease and doing everything that we've been told works.
Yeah, because it's very important, because we've seen how very quickly this could affect the entire health systems. We've seen how it could be overwhelmed. And even the people who are at the forefront, just like you mentioned during the Ebola period, are the health workers.
Yes.
And so there's a lot more call for training and getting the personnel ready. I'd like you to speak to that aspect also, and also take us back into how you made that work in your work with polio as well.
So really, training health workers is key. Training them, giving them the tools, the knowledge and the understanding of what to do, and also giving them the physical tools to work and do their job is critical. So the reason why we want to fund right now the training of the frontline health workers in the states where we think that there's a greater risk for corona is because if people don't know what to do, then presented with cases, they would either let people go through or not know what the first life-saving gestures are, especially for themselves, right? Remember, during the Ebola crisis, we lost a lot of doctors and medical personnel in those countries, and that made the crisis even worse, because now if the doctors and the nurses are sick and die, then who's going to take care of the other sick people? So it's really important that they know what to do and that they're equipped. So within the polio work and the routine immunization work, there's also this component about upgrading the skills of health workers. So right now we're working with the Primary Healthcare Development Agency of Nigeria to come up with a systematic training program for all community health workers, for all nurses and doctors. So we have centers that exist. Some of them are not in the best shape that they need to be in. So we are working right now with Dr. Faisal to make sure that we can upgrade those and make sure that people are trained to the best of their ability to face everything that we're dealing with when it comes to health in Nigeria.
All right, one other area that I would like to get into is the area of data. You know, I can imagine you working, doing the kind of work you're doing in the terrain you're working in. Some areas are very hard to reach. You know, even getting personnel who are trained to manage and collect the data, and then to the point where it's even been analyzed and used meaningfully.
Right.
You know, I'd like to speak to all of that and how that has affected your work so far, even across the level of work that you're doing, polio and all in other areas.
Yes. So data, as you pointed out, is critical. Without the right data, then we don't even know what we're doing, right? If we don't have the right information about what the challenges are, how many children were immunized, we're not keeping track of how many health workers are where, then we really won't know what we're doing and we won't be able to be effective. So we had a very strong component of data integrity and data quality within these MOUs that we signed with the states. We had a couple of sessions with the governors, and they were very difficult sessions to talk about, you know, the difference between what their administration is reporting and what the SMART survey says. SMART survey is just sending people to go and double check the information that you say. So have enumerators that go in and double check, oh, you say that these, you know, people were immunized, okay, let's call them and the numbers are not there, or the people never came, or, you know, you go and you double check physically and the people who supposedly came to the center didn't come. So we had very difficult conversations with the governors, and I think everybody really understood how important it was to not have a big gap between what the state is reporting and what an independent survey is finding, and that gap has been reducing. So there's a lot more confidence that we have in the integrity of the data that we're collecting right now.
All right, but then looking at the foundation now, projecting into the future, looking at the challenges that we're seeing in the world right now, we discussed coronavirus already. As you strategize into the rest of the year, I'd like you to know what areas you guys are looking at and saying, okay, you know, if we're going to improve quality of life of people in these areas, we should focus on so and so areas.
So Aliko Dangote Foundation works in 3 major areas: health, education, empowerment. Humanitarian work is what we do when there's a disaster, but it always falls within those 3 pillars anyway: health, education, empowerment. So we really have 3 pillars in which we work. Right now, our priority immediately right now is to be as effective as we can in helping to contain this COVID-19 threat, and to continue to consolidate the gains that we've had, that we've recorded so far in the work that we've done in these MOU states. We are working on a very, we're on a more comprehensive health intervention, and that's what I had mentioned earlier, which is really around improving the quality of the primary healthcare system in Nigeria. We had very good conversations with the National Primary Healthcare Development Agency, and we want them to do the best that they can to make sure that in each of our wards we have a functional primary healthcare center that can cater to people's needs. Most of what people need to have done health-wise is in the primary healthcare system, and we have a lot of gaps there. So that's really our number one focus right now, is really on this primary healthcare space. Because if that works, then everything else that we can layer into it will work. So we'll have a better nutrition program, we'll have better maternal and child care interventions. Everything that we do to help the well-being of Nigerians will be better if the primary healthcare system works. And this is a lesson, I think, that we've come to, because we did different interventions, but ultimately, without fixing the system through which these interventions are delivered, a lot of things get lost and dispersed. So supporting the primary healthcare system in Nigeria is our number one priority. The second one, education. We've been looking at how to tackle the issue of the 10 million out-of-school kids that we have in Nigeria. There's all kinds of different interventions that are happening in different places, but we have a scholarship program that we're doing for 5,000 girls. We have, the work that we've done in different universities, and right now is to see how, maintaining those and upgrading those, and that those investments are ongoing. So yes, we built the Dangote Business School at BUK in Kano. Okay, how is that going? What else do we need to do? How do we help that business school develop global partnerships and really supporting it to become a flagship, wonderful school. It's not that we're going to go and be building business schools everywhere, but just really
impact, yeah.
Exactly making sure that the impact that we were looking for is really there. And on the empowerment side, we run these micro grant programs, which we do the idea is to do all 774 LGAs in Nigeria. So Aliko wants us to find, together of course with the states, the 1,000 most vulnerable women in all of our 774 LGAs across Nigeria and give them a cash grant so they can improve their livelihood, really, start a business, expand their business. They have, income generating activities, but something that can help them take it to the next level. And that's, come with challenges here and there.
I can imagine.
It's not easy, but it's good. But that's what we're working on.
Thank you so much for your time today. It's very interesting to see how the private sector is helping to bridge the development outcome gap in there. Thank you so much. I've been speaking to Zouera Youssoufou. She's the Managing Director and the CEO of the Dangote Foundation. And that's it on Beyond Markets. And thank you so much for joining us. Remember, you can watch the show at 5 p.m. West African time daily and have access to all previous episodes of Beyond Markets on our website, which is at cnbcafrica.com. You can also stay engaged with the hashtag Beyond Markets and follow me at my handle, and that's at Kenneth Igbomor. Send me a message and let me know what you think. Have a wonderful day.